Hello everyone, and welcome to Defeating Lyme's Disease, a Holistic Approach. I'm Dr. Adam Seay. Many of you are watching this DVD and you may have the diagnosis of Lyme's disease, or you may have an autoimmune disease such as rheumatoid arthritis or MS, or you may have lupus, or even Lou Gehrig's disease, or you may have a chronic condition that no one can seem to pinpoint or seem to get you any relief. Well, hopefully this DVD will shed light on what Lyme's disease does to us and a lot of the diseases it tends to mimic. The goal of this DVD is to have maximum positive impact on everyone that watches it. I also want to give you copious amounts of information on Lyme's disease so that you can help combat this naturally. And I also want to eliminate that roller coaster ride that you're on, going from doctor to doctor to doctor with little to no results. And I also want to reinvent your life. Not very many physicians say that, but that is a goal in our office, is to reinvent your life. This DVD will provide you with the latest breakthroughs in non-surgical, non-drug treatments in Lyme's disease. So you want to get out some pen and paper. You're going to want to write a lot of this down because you don't have to go back through the whole DVD again, so hit some of the highlights that you find that are important, and you're going to want to write those down. First of all, we let people know we do not cure, we do not treat Lyme's disease. All we do is work with your body and your physiology to improve the function of the body. That's our goal in our office. We don't label you with anything. I also want to get to the root cause of your chronic problems. And many people have chronic issues and may or may not have Lyme's disease. We want to do that, not just treat the symptoms. And the culprit behind this is usually inflammation, it's toxicity, and it's a decreased immune response. I'm here to tell you that there is new hope available to you in this. So who am I? Again, I'm Dr. Adam Seay. I'm a board-certified chiropractic physician, been in practice since 2005. We do some soft tissue technique called active release, which we are full body certified in. And we also, my practice focuses on functional neurology, focus on applied kinesiology, and also in functional medicine. I am a member of the neurometabolic supergroup. This was founded by Dr. Michael Johnson, who personally has dealt with Lyme's disease and does a phenomenal job of treatment on this as well. So we have a great asset that we have access to help us get our patients better with Lyme's disease. Some great resources to check out are lifechangingcare.com. Another great resource is AskDrJohnson.com. Dr. Johnson has multiple books that will be coming out. One that's already out is Dr. Johnson's thyroid book, which is available at drjthyroidbook.com. It's called You Can Beat Thyroid Disorders Naturally. So what in the world is a chiropractor doing talking about Lyme's disease? Well, I want to show you kind of the differences between the two professions, and most people associate medical and chiropractic, but this is back into schooling. When we look at chiropractic hours versus medical hours in anatomy, it's 520 versus 508. We see in physiology 420 versus 326. Neurology, we're seeing 320 versus 112. And into diagnosis, we see 370 and 374. So if you add up all the hours, for chiropractic, we're at 4,485. For medicine, we're at 4,248. So you can see we're not that different. We understand physiology. We understand how the body works and how we can do things naturally to help your body improve. And that's what it's all about. We want to support the body in order to allow maximum healing. This is what it's all about. My goal is to help you find the most effective ways to enhance your immune system, to detoxify your body, to decrease inflammation, so that you can reach your God-given potential. So what causes the excessive amounts of inflammation, toxicity, and a decreased immune response? Cause number one to excess inflammation, toxicity, and decreased immune response is going to be acidic, being too acidic. What causes your body to be acidic? Poor diet usually contributes to that. Toxins, heavy metals, and infections. You have to be alkaline to heal. So a proper pH should be from 6.4 to 7.0. Anything over 7.0 is bad news. And what we're talking about, we're not talking about salivary pH, we're talking about first morning urine pH. So how do you test this? I already said it, but we do first morning urine strips, pH test strips, in the urine, not saliva. When your body's acidic, your body's going to leach minerals from your bone and actually place them into the blood to buffer the blood. So what your body's doing is prioritizing what's more important. Do we become toxic and die in just a matter of minutes? or do we, at the expense of our leg, preserve the body? So the body says leg or liver, which one's more important? Definitely liver. So when you're acidic, you're most likely to have a heavy metal toxicity, which will cause a milieu of free radicals to happen in the body. So again, this is huge when it comes to how the liver detoxifies. And being acidic also sets you up for an internal environment that is a breeding ground for viruses and bacteria. So again, if you have Lyme's, we're gonna want to get your pH back into balance, because you're gonna help your body heal and reduce that likelihood of those organisms thriving. So how does one become more alkaline? Well, you got to change your diet. You got to eat more vegetables, and you have to drink good water. To supplement as well to obtain an optimal pH, we use minerals. We use a product called Coral Legend. It has minerals in it. We also use aloe. PRL, a company that we use, Premier Research Labs, has a product called Aloe Pro. And we also use vitamin D, D3 serum from PRL. The problem that's out there that many of you said, well, I've done this, it doesn't help. And the vast majority of the issue is there are cheap, poor nutritional supplements that are out there. Consumer Reports even has highlighted this on the 10 surprising dangers of vitamins and supplements. Here it is on their front page. So they understand that there's risk to taking bad supplements. So you definitely don't want to do that. You want to take quality supplements, and that's what we offer here in our office. You're also going to want to avoid anything that's been enriched. Breads, pastas, crackers, cereals, waffles, rolls, buns, pancakes, anything that's been enriched. If you go to Google or go to YouTube and type in magnetic cornflakes, you'll see a kind of a neat experiment. Guy takes cornflakes, mixes water into a blender, starts blending it, puts a magnet up against the side, and you actually see the iron being attracted to the magnet. So they're putting rock forms of iron into enriched food. And we'll talk about later what this does to us. You're also going to want to avoid organophosphates, which are pesticides, because these deplete the liver's ability to detoxify in the body. Vitamin D is usually solvent extracted from sheep's wool. And we also see you're going to probably want to avoid glandulars if you can, because you'll be exposed to everything that animals been exposed to, whether it's pesticides, whether it's antibiotics, hormones, and you also have GMO feed, other things that these animals have come in contact with. We can take that in if we're taking glandulars. What we're going to look at is your nutritional supplements should test onto all 4 biofill polarities. What we mean by that is you should have 4 different polarities on the hand. This is a positive, a negative, a positive, a negative. And a lot of this work is pulled from Fritz Alfred Popp. Dr. Popp was a German physicist that discovered the plasma energy field. And what he found is most of the biophotons will leave out through the digits and toes. So what they look at here, this is a positive, negative, positive, negative. So what we mean by testing on to all 4 biofill polarities is that you should be strong on this polarity, you should be strong on this polarity, you should also be strong on this polarity, and on the last polarity. When we muscle test or do energetic testing. So if we find that you do not test on with the nutrition to all 4, it's not going to be energetically sound for the body, so we don't use it. CoQ10 is oxidized. Vast majority of CoQ10 out there is oxidized. And B vitamins are coal tar derivatives. And so a lot of you have noticed probably when you take B vitamins, your urine turns a nice fluorescent yellow. It's part of the reason why. They're not naturally derived. And ascorbic acid is not vitamin C. True vitamin C will reverse scurvy. So we see ascorbic acid does not do that. So it's not truly vitamin C. And this is one of the main reasons we mainly use Premier Research Labs in our office. We use a couple other companies as well, but Premier Research Labs is very particular about what they use, and they want the energy to be there as well. Synthetic nutritional supplements can actually cause free radical damage and have excitotoxins. Additionally, they are full of chemicals that also cause xenoestrogens. Free radicals and excitotoxins cause massive amounts of inflammation, toxicity, and a decreased immune response. Let's go over an example of this. Again, you want to avoid anything that says enriched because it's rock forms of iron. Ascorbic acid is not truly vitamin C, like we just said. It's in many processed foods and in junk food. So when you take in ascorbic acid and consume it with the enriched food, the iron causes the oxidation of ascorbic acid, and it forms what's called dehydroascorbic acid, which is a free radical, a pro-oxidant, and it's damaging to your brain's neurons. So you definitely don't want to eat enriched food and junk food that has a lot of ascorbic acid in it. And this is why a lot of people wonder why they have brain fog, and that's part of the reason why we're actually breaking down some of the neurons in the nervous system. This is just one example. Let's look at another one. Let's look at tyrosine. Tyrosine is made by the combination of iron and phenylalanine. So rock iron accumulation from enriched foods cause the liver not to absorb more iron, and therefore you cannot make tyrosine. And you need tyrosine to make thyroxine, which is T4, or adrenaline. So many of you that are watching this probably have thyroid problems. You're wondering, well, why is my thyroid not getting better? Well, this is part of it. You got to eliminate those foods that are contributing to this. So cause number 2 of increased inflammation, toxicity, and a decreased immune response is going to be free radicals and excitotoxins. Long before Lyme's disease has been established, the affected individual typically has been exposed to a plethora of heavy metals. They've had toxic chemicals, inadequate nutrition, which leads to free radical formation, and excitotoxins. So free radicals damage the mitochondrial DNA of the cell, and this is the powerhouse of the cell. The mitochondria has multiple other uses, but this is one that it's most noted for in kicking out ATP for energy production. So let's look at some causes of free radical damage. Cause number 1 is going to be a poor diet. The use of trans fats or hydrogenated oils, junk oils, diet high in refined sugar, white flour, and white salt. We call this white death. Having food sensitivities, gluten, dairy, soy, and others. Cause number 2 is going to be toxic chemicals. It would be hormones in meats and in dairy. You have pesticides in fruits and vegetables. Number 3 is going to be heavy metals. Mercury amalgams and fumigants, nickel dental crowns, fluoride in toothpaste, you can have chlorine in water, you can have bromine in breads and flame retardants. Let's look at excitotoxins. Excitotoxins are neurotransmitters that cause cell death when their action is prolonged. Excitotoxins are compounds such as glutamate, a good example of that's MSG or monosodium glutamate, and aspartate or aspartame and homocysteine. And these are all examples of excitotoxins. Excitotoxins cause premature cell death by initiating the p53 gene. So when aluminum is bound to excitotoxins such as glutamate and or aspartate, its entry into the brain is greatly increased. And once into the brain, aluminum increases iron-induced free radical activity. And that is the current model for how the brain degenerates, or the neurodegenerative model is an excitotoxin-based model. So don't just take my word for it. 2 studies here. This is back in 1995, modification of the blood-brain barrier through chronic intoxication of aluminum glutamate, possible role in the etiology of Alzheimer's disease. And then in 97, we see aluminum potentiated glutamate-induced calcium accumulation and iron-induced oxygen-free radical formation in primary neuron cultures. And all this comes about too in another article that was done by Dr. Robert Marshall, who's the founder and formulator for Premier Research Labs. He's a biochemist. He says the overlooked role of chronic infection in neurodegeneration and its reversal using nutraceutical agents. So that's the beauty of this, is that these things can be reversed. We just have to figure out what's going on and how we can combat it. So cause number 3 of increased inflammation, toxicity, and a lowered immune response. No surprise here, and this is probably what the vast majority of you watching this have an issue with, is infection. Lyme's, multiple co-infections, including viruses, bacteria, parasites, and other dental infections are usually the culprit. And this is where a lot of people don't look, are in the teeth. You got to look at the teeth for dental infections. So if you have dental issues, a good website to go to is www.noamalgam.com. And you can read about how you can find someone that can help you extract mercury amalgams, because these will wreak havoc on your body. Also, another great site to find someone who is certified either biologic dentist or a holistic dentist is IOAMT.org. So while we're on the topic of discussing heavy metal exposure, let's look at the big ones. Big ones usually are going to be mercury, aluminum, nickel, other heavy metals like thallium, uranium we come into contact with a lot. Think of your mouth. Say you have mercury amalgam and a nickel crown. These are 2 dissimilar metals in a saline solution or in your mouth as your saliva. That's a battery. So this causes the mercury to leach out of the amalgam 80 times faster. So you can imagine what these things are doing to your nervous system. Another mercury contaminant are going to be grains and produce, and this is something most of us do not think about. You know that they use mercury fumigants to control pests in buildings and where they store grains and produce. So what about food and fish? Because a lot of people are consuming fish. If you are going to eat that, you're going to want to avoid the ones that have higher contents of mercury. Things like tuna, swordfish, orange roughy. If you eat it in moderation. Don't go crazy with it, because you're going to get more mercury. The other issue that we see a lot of times is you could have a parathyroid problem. And the parathyroid protects you from heavy metal exposure. The problem is no one addresses the parathyroid. The major function of the parathyroid gland is to maintain the body's calcium level, so it buffers the blood. So we see kind of how this is all coming together. If your parathyroid's not working, guess what happens? Your blood will not be buffered, and you're going to be acidic. Plus, the parathyroid is the most sensitive organ in the body when it comes to heavy metal toxins. So again, no one's addressing this. We've got to get the parathyroid functioning better to help maintain proper pH as well. The number one nutrient to support the parathyroid is going to be green tea ND. Green tea ND is the equivalent of about 40 cups of green tea. And this is great too. We'll kind of highlight it a little bit later on, but green tea will actually lower interleukin-6. It's one of the few things out there that will drop interleukin-6, and this is a big problem in a lot of Lyme's patients and a lot of chronic conditions as well. Cause number 4 of increased inflammation, toxicity, and a decreased immune response is going to be autoimmunity. And a lot of people that have Lyme's have gone into autoimmunity, and that's where they get the diagnosis. You have lupus, you have rheumatoid arthritis, you have MS, you have Hashimoto's disease. It just goes on and on that they say, hey, we found it, you're autoimmune. But a lot of times the body's not stupid. Why did the body become autoimmune? Typically something's triggering it to do that. So what does this mean in general? It just means your immune system's attacking your body. So how do you stop the immune system from attacking your body? You got to decrease inflammation. We got to detoxify the body, and we have to improve the immune system. In addition, you need to find the antigen or the trigger that's causing the autoimmunity. No shock here, Lyme's disease can be a trigger. It can trigger Hashimoto's disease. It can trigger other ones too. We've seen it in a celiac patient. It also can trigger environmental chemicals can be a trigger for it. Pesticides can also be a trigger. You can have other infections. You could have parasites or viruses, heavy metals. All these things can trigger the body to upregulate and attack cells. So there are two parts to your immune system. You have a Th1 response and a Th2 response. Th1 is going to be the destroyers of the immune system. These are the Navy SEALs that go in and identify the targets and kill them. Th2 is going to be your surveillance system. It's the antibodies that remember the bad guys. So Th1 support is going to be vitamin A, vitamin C, and zinc, astragalus, echinacea, licorice, you can have lemon balm, maitake mushroom, and garlic. Just a couple examples. Th2 support is going to be pine bark extract, green tea, grapeseed extract, resveratrol, pycnogol, lycopene, and caffeine. All of these are Th2 stimulators. There are other ones that are out there as well. The other key that you have to remember too is that 80% of your immune system is around your gut. So this is vital when it comes to supporting and building up your immune system. And one of the biggest problems that we see in Lyme's patients is kind of shocking, and most people don't associate this, but it's hypochlorhydria, which is low stomach acid. And HCl allows for better flow of your lymphatic system, and it's your primary methyl producer. So we have to get the stomach back online. It really helps a lot with Lyme's. So how do we test for it? You can go into blood work, and we do blood work. You can do total protein, you look at your blood urea nitrogen, your serum globulin, your phosphorus, your calcium, and your creatinine. You can also do applied or clinical kinesiology testing to see what does the stomach need. In order to maintain proper HCl, no alkaline water. Water should not be the place that you get proper things for pH. It should be, you can put things into the water like minerals, but it shouldn't be your sole source of alkalizing the body. In order to properly detoxify and prevent expressing bad genes, one must undergo proper methylation. So what's the primary donor of methyl groups for your body? You guessed it, HCl. And this one place that the body wants to be acidic, and it's the stomach. So you need adequate amounts of HCl. And it's not what the drug companies and the television markets to us, that it's this volcanic eruption of acid. They've done Heidelberg capsule studies and have found it's not too much acid, it's not enough. So they estimate by the age of 30, we've burned through our reserves for HCl, and it's downhill from then on. So the vast majority of people are experiencing lactic acid, and that's the effect that they're feeling. This is why it's so important that you have proper amounts of stomach acid. Methyl groups are vital for normal cell replication at the level of the DNA. So this is huge. They turn genes on and off. When you have depleted methyl groups, bad genes like oncogenes are turned on and good genes are turned off. So all this work has come from the Human Genome Project back in 2001, when they finished mapping our DNA, and they found out that 2 to 3% of our genes actually control who we are. So they found they had 97 to 98% of these things out there. They did not know exactly what they did. They called them junk genes. About 4 years later, they found out these things aren't junk genes. A vast majority of them are oncogenes and viral genes. So we have the ability to turn on cancer. We have the ability to turn on viruses. We can get sick and not be around anyone that's been sick. So that's where we look at. And what those methyl groups do is it actually turns on what's called tumor suppressor gene. And tumor suppressor gene will keep your oncogenes from turning on. So if you're dealt BRCA1, BRCA2, if you have adequate amounts of methyl groups coming into the cell to keep tumor suppressor gene on, you'll never express BRCA1, BRCA2. So methyl groups are vital for phase 2 liver detoxification, proper methylation, homocysteine metabolism, neurotransmitter synthesis, and nucleic acid synthesis. So this is why the stomach is so important in having adequate amounts of HCl. So inadequate methylation capacity leads to birth defects. You can get depression, you can have cognitive decline, and even cancer. And we'll see kind of a little correlation with this later on with the MTHFR gene. So impaired methylation has been even associated with autism. So again, a lot of chronic issues come back to methylation. So let's review. Causes of chronic problems associated with Lyme's are inflammation, toxicity, and a decreased immune response. We went over the top 4 causes. Acidity, being too acidic is one, free radicals and excitotoxins, infection, and autoimmunity. So how do you know what to do? How do you know if one of those are my problem or all 4 are my problem? We go to lab testing, we go to kinesiology testing to show us that. But before we get into all the lab testing and kinesiology, let's talk about Lyme's disease. Lyme's disease is caused by the bacteria Borrelia. Borrelia burgdorferi is the most common species in the United States. There are multiple species of Borrelia. And Lyme's disease is the fastest growing infectious disease right now in the United States, probably even worldwide. Lyme's disease is a tick-borne illness that can carry with it several co-infections. But unfortunately, Lyme's disease is very difficult to diagnose because it can actually shape change and morph into 3 different phases. So let's look at those 3 phases. Borrelia has the ability to shed its cell wall and has the ability to move into a cyst formation, which you can actually see the cyst formation that they're demonstrating here. And it also has the ability to move as a spirochete, or a corkscrew is kind of what a spirochete is, and you can kind of see the spirochete out here. So the other thing that Lyme's has the ability to do is create a biofilm. We'll talk about that as well. A biofilm is formed when the bacteria lands on a membrane or even an organ, and it can secrete a mucus. Good estimate for this is the stickiest snot you can imagine. That's what this mucus is like, and it allows the bacteria to actually reproduce and replicate inside of this biofilm. The problem is once this biofilm reaches over 4 millimeters, the immune system cannot penetrate into it. And the other downside to this as well is antibiotic therapy does not address the biofilm. So many of you, if you've been taking antibiotics and you feel amazing on them, and then you come off of them and you rebound and get floored again, this is why, because you have biofilms. And what happens is once the antibiotics kill the bacteria that are in their flagellate state and they die off, and you get that cleared, and then you come off the antibiotic and then you get floored again as the biofilm's breaking loose again. So we have to go after things that will shrink the biofilms, and there are things naturally that will do that. So let's look at the incidence of Lyme's disease in the United States. Here's a map, 2011, from the CDC's website of reported cases of Lyme's disease in the United States to the CDC. And folks, you can see from this, most of it's upper Northeast, maybe upper Midwest, and that's where we see the vast majority of these. I'm in North Carolina, there's only a few dots present. We see this a lot. And they're just not reporting the cases because part of the problem is the testing, and we'll go over that as well. Here's some of the confirmed cases in the dark green. The lighter green are probable cases. And you can see this thing is on the rise over the years. And that's, again, just confirmed cases that there's been reported. There's probably way more than that that aren't being reported. Lyme's disease is transferred to humans by ticks, but some research has actually seen this into fleas, horseflies, and even mosquitoes. They're not there yet, but they're seeing some of this transferring over. Borrelia is the species of bacteria that causes Lyme's disease. And Borrelia is found in your tears, it can be found in semen, vaginal fluid, and saliva. And Borrelia, again, is the spirochete bacteria. Very close relative to that is syphilis. And it can be transmitted the same way. We know syphilis is a sexually transmitted disease, so it can be passed from spouse to spouse, or someone that you may sleep with or have sex with can be transferred as well. Borrelia can also be transferred in utero, so it's not uncommon for a mom to have it and actually pass it on to her child while they're developing. So let's look at the tick that most people associate with it, which is the deer tick. Again, shows you the life stages of the deer tick, but it's not only in the deer tick, it's actually now in all ticks. So it doesn't matter which one it is. The dog tick is here, the Lone Star tick, and the black-legged tick. And you can see even the nymph, which is the second one running up here. The nymph can contain Lyme's disease as well. And what happens a lot of times is the nymph can bite you, stay on for a while. Typically what has to happen is they regurgitate back into the bloodstream from eating, and then Borrelia or other co-infections can come in with it, and then you can get Lyme's disease. But a lot of people have had tick bites and have tested positive even on Western blot and never recall a tick at all being on their body. We've seen it. And part of that issue is the nymph. The nymph is about the size of a period at the end of the sentence. So if that thing falls off and you never recall it, then you could actually end up with it and never see it, and maybe even never see a bullseye rash. The timing that we see most of the activity of ticks is usually going to be spring and summer. Fall, not quite as much, maybe a little bit more on the adult side, but those are usually when most people are out and about, are going to be in the spring and summertime. Great protection against ticks too is going to be lemon and eucalyptus. So if you have essential oils, lemon and eucalyptus, they hate and despise that, so it's a great one to do. You're going to want to wear long clothing. Sometimes if you can't, again, go to the lemon and eucalyptus oil, works well. Lyme's disease can carry with it many co-infections. And common infections include ehrlichiosis or anaplasmosis. You can have Bartonella, which is well known as cat scratch fever. You can have babesia, which is similar to malaria. You can also have another organism called FL1953, and this is similar to malaria or similar to babesia. It's a protomyxoa that Fry Labs has discovered. Fry Labs says that this organism will create a biofilm actually inside the brain. You will see this thing on MRI, and we actually have seen patients with this. We've seen Parkinson's patients with this, testing with FL1953, having documented cerebral infarcts on their MRI, and it actually is FL1953. So this is a nasty thing that likes to come in with Lyme's. You can also get mycoplasma. We can get Brucellosia, chlamydia, like chlamydia pneumoniae. You can also get salmonella, leptospirosis. You can get rickettsia or Rocky Mountain spotted fever. You can also get what's called START, which is southern tick-associated rash illness. And you can get TBRF, which is tick-borne relapsing fever. There's so many other ones. You can get Epstein-Barr virus, cytomegalovirus, you can get herpes. I mean, there's so many things that come in with Lyme's disease. It's actually kind of scary. So are you tired of struggling with pain, fatigue, numbness, tingling, neurologic deficits, all those other issues that come along with this day in and day out? So let's look at some of the symptoms that are associated with this. The acute symptoms that are associated with acute Lyme's disease, meaning you recall a tick bite, you see either a bullseye rash, and you wake up and you feel horrible. You feel like you've had the flu, you got joint pain, you have fatigue, you have headaches, you have a rash, you have brain fog, you feel like you've been run over by a truck. This is usually acute Lyme's disease, and this is actually where antibiotics work well. A bullseye rash is pathognomonic for Lyme's disease, meaning if you see the bullseye rash, you don't have to worry about testing. It's the only thing that gives you this is Lyme's disease. And this rash is known as erythema migrans. And the rash typically, statistics I've seen is 20 to 50% of the time. The highest statistic I've seen is 50% of the time you'll get a bullseye rash. So not everybody gets it, and you can still get Lyme's disease even though you don't have a rash. And it can take up to from anywhere from 3 to 30 days for this to actually appear. Chronic symptoms associated with Lyme's disease can be some of the acute ones that we already mentioned, but they tend to get labeled as something else, and it tends to mimic about 300 different diseases: multiple sclerosis, Parkinson's, ALS, Lou Gehrig's, Alzheimer's. You can have degenerative joint disease or degenerative disc disease. It presents a lot of times like arthralgia or osteoarthritis. You can have fibromyalgia, chronic fatigue syndrome. You can have rheumatoid arthritis, lupus, Hashimoto's disease, all these other autoimmune diseases Lyme's mimics. And it's kind of scary in what it has the ability to do. And we'll go over why a lot of times we see this mimicry that's happening in the body. Are you having difficulty sleeping? Are you having migratory pain? Do you have chronic fatigue or fibromyalgia? These are all signs of chronic Lyme's. Do you have immune dysfunction? You tested positive with an ANA. You've had a positive rheumatoid factor. Do you have any neurologic disturbances? Can't sleep at night. Do you have ADD, bipolar, OCD, depression, anxiety? All these things can be a sign of Lyme's disease. And going back to neurologic disturbances, do you have numbness, tingling in different parts of your body? Or both legs start to burn or tingle? Do you have allergies? Do you have endocrine system disorders? Do you have any GI disorders that are there? All of these can be signs of chronic Lyme's. So many of you may have one of the previous mentioned diseases, or you've been tested for Lyme's, but it comes back negative. Part of the issue with that is conventional testing. Conventional testing starts with ELISA. ELISA misses about 2/3 of cases. If ELISA comes back positive, Western blot is then performed as a confirmatory test. And Western blot has a 44.6% sensitivity to Lyme. So you can see a lot of times this is missed in conventional testing. So due to the inability to accurately detect Lyme's disease, it's missed in many cases. So we see that conventional testing misses the majority of cases. So how do you detect Lyme's disease? Well, you can do other advanced types of tests. You can also do kinesiology testing. But Lyme's disease is not a disease of a laboratory test. You have to look at the person completely. You have to look at their clinical manifestations. You have to look at their health history. You have to look at laboratory trends and tests as well. So it's not just a lab test that's going to diagnose Lyme's, because this thing is very, very difficult to find. Some other lab tests that you can look at, one of them is called the CD57, which is the HNK1 test that LabCorp does. You can also look at your complements, complement C3A and C4A. You can also test the 25OH and the 125OH vitamin D. And a lot of doctors don't run the 125OH, but that's another one you can kind of use to screen for it. You can also look at your tumor necrosis factor alpha, your interleukin 1 and interleukin 6. And these correspond to what we call sickness syndrome. These are your inflammatory markers, your inflammatory cytokines that will really ramp up in cases of Lyme's, and this is where all the joint pain. The person feels horrible. They may be vomiting or just cannot get out of pain. This is due to those inflammatory cytokines. We can also look at iGenetics, does a test. They do some PCR testing, and they also do a detailed Western blot, goes a little bit beyond what the CDC looks at to find Lyme's. We can also go to advanced labs. They can do some through blood culture to see, do we find it? And another great lab is Fry Labs. They do PCR testing. They will also do a Western blot, and they will look at it microscopically as well to see, do we find Borrelia or either other co-infections like Babesia or Bartonella. Some of the trends that we see in Lyme's patients through their metabolic testing, we see usually high or low white blood cell counts. You can also see high lymphocytes, maybe low neutrophils or vice versa. You could also see high monocytes, and eosinophils are typically found with Lyme's. You can have insulin resistance, which is usually a high fasting blood glucose and a high A1C, hemoglobin A1C. You can also have a high C-reactive protein, your fibrinogen, your homocysteine levels could also be high, your SED rate could be high. You can see your thyroid antibodies, and Hashimoto's is usually an autoimmune disease that can form as a result of Lyme's disease being present. Typically there we see your TPO antibodies, antithyroid globulin antibodies come back positive as well. Imbalanced in your electrolytes, sodium, potassium, chloride, magnesium. We'll see the trend typically with your CD57 is it's going to be low. You're going to see that being suppressed. You're also going to see high complements. So your C3A and C4A are going to be elevated. So if we see a low CD57 and a high complement C3A and C4A, then it's probably a pretty good likelihood that we're dealing with Lyme's. You can also have the MTHFR gene, which is the inability to methylate properly, and we'll go over more about this later. You can also have low 25-OH vitamin D when they test your vitamin D. You can also have high 125-OH vitamin D. Typically here with the challenge that you can do is if the person has that scenario, it's a low 25-OH and a high 125-OH, you can give the person a high amount of vitamin D, about 10,000 units over about a 2-week period, and then test it again. And if we see that this scenario does not change, at least in particular with the 125-OH, the 125-OH stays high or even goes higher, then we know we're dealing with Lyme's disease, because Lyme's and other bacteria such as mycoplasma have the ability to shed their cell wall. So if this 125-OH isn't coming up, then we usually are suggestive that this may be Lyme's, that it's shedding its cell wall. You can also see anti-cardiolipin and antiphospholipid antibodies can show up as well. You can also have elevated liver enzymes. You can have elevated uric acid levels, your blood urea nitrogen, creatinine levels can be high. And again, you can also test positive for an ANA, rheumatoid factor, and other autoimmune markers. And you can have high coagulation markers as well. And typically, if we see that the person does not have a genetic predisposition for coagulation and their markers are a little high, then that may be suggestive of Lyme's disease, because Lyme's likes to take the clotting ability of the body and use that to make biofilms. So this is another great way to kind of screen for people as to whether Lyme's may be there or not. Borrelia has the ability to express lipoproteins on the outer membrane of their cell wall. And these lipoproteins are pro-inflammatory, so that's why it tends to drive up the tumor necrosis factor alpha, the interleukin 1 and 6. And these lipoproteins attract neutrophils and induce cytokines and lymphocyte transformation of B cells 50 to 500 times more than any lipoproteins on any other bacteria. So this is where we get this huge inflammatory response from these lipoproteins that this bacteria is emitting from their cell wall. Molecular mimicry can also occur in the peripheral nervous system when Borrelia-specific IgM antibodies go after the flagellin, which is the tail-like component of the bacteria. And cross-reaction can occur with the neuronal myelin, giving the presentation of MS-like symptoms or neuropathy. So if the person says, I've been diagnosed with MS, or you have MS-like symptoms, but it's not definitive MS, or they have neuropathy, again, this could be Lyme's, because we know that the body can be creating IgM antibodies to the flagellin, it can mimic the myelin sheath of your nerves. And these agents create an inflammatory cascade. Again, tumor necrosis factor is going to be high, your interleukins 1 and 6, which is going to produce free radicals and oxidative stress that damage cell membranes, mitochondria, and nerve cells. So again, we see what we talked about earlier and what the bacteria itself has the ability to do. Some agents produce neurotoxins, in particular quinolinic acid, and other toxins that damage the nerve cell. Autoimmunity may result from antibodies against these agents that cross-react with our own tissue. So again, your body's not stupid, it's responding to what's happening in the body. So these organisms are secreting all these things that are creating this inflammatory cascade that may actually trigger the body to attack cells. And Lyme's has the ability to release what are called blebs, which are shed particles of partial DNA from their plasmids, and that's where bacteria hold their DNA in plasmids. These blebs cause the immune system to react, and the blebs convert host cells into immune targets. So this is where one can get a positive ANA, rheumatoid factor, they can get other autoimmune factors, they start to come back positive, and you see even more severity in Lyme's cases if the person is positive for HLA-DR2 and DR4. So this is why those immune markers start to come back positive. The second component to identifying Lyme's disease is kinesiology testing. We use energetic test vials from a company called LifeWork Potential that has the frequencies of the organisms in the test vial. And they have all species of Borrelia, not just Burgdorferi, but multiple other species that are found throughout the world. They have other species of Babesia. They have other species of Bartonella as well. So a lot of times we will kinesiologically test to see, is your body responding to this? We don't say you have Lyme's, we just see what does your body show us in regards to the immune system and what we can do to try to combat this. So let's discuss the predominant co-infections associated with Lyme's disease. Bartonella. Bartonella is a big one. People tend to be cold with Bartonella. You have cold hands, cold feet. Thyroid issues will as well. You can have sharp pains on the soles of your feet. You can get sharp shooting knife-like headaches. You can have hot flashes. You can have joint pain. You can have swollen lymph nodes. You can have gastritis. You usually tend to see high liver enzymes, maybe an enlarged spleen. And you can also have insomnia. And again, Lyme's disease is the worst on insomnia. People that cannot sleep despite other types of medications, despite Ambien and other things, and they can't sleep, usually you're dealing with Lyme's disease. Bartonella can develop into the following. You can get bacillary angiomatosis and pileosis hepatitis, Carrion's disease. You can get cat scratch fever. You can get chronic fatigue syndrome. You can get endocarditis, which is inflammation of your heart valves. You can get erythema multiforme, which is pink and red skin blotches. You can get erythema nosotum, which is inflammation of the fat cells under the skin. And you can also get recurrent bacteremia, which is bacterial blood infections. You can also get uveitis, which is eye inflammation, and thrombocytopenia purpura, which are low platelets. So again, if we see this scenario, we're seeing low platelets, high liver enzymes, you see this kind of scenario, then we are most likely dealing with some type of infection, maybe Bartonella being one of those. Let's look at Babesia symptoms. Babesia, again, very similar to malaria. We see fatigue, night sweats, joint pain. We'll see fever, chills, weakness, weight loss. We'll also see nausea, iron deficiency, anemia. We see abdominal pain. You can have shortness of breath. So Babesia actually likes to get into the red blood cell. And this, a lot of times people will have shortness of breath, or what we call air hunger. So if the person's like, I go up in altitude and I get floored, it could be Babesia that's there causing this air hunger. You can have cough, you can have a headache, you can also have neck and back stiffness, and you can have a dark or bloody urine, and this can be a sign again of Babesia. Let's talk about ehrlichiosis. Ehrlichiosis, you can also have fever, chills, you can have muscle pain, headaches, confusion, neurologic consequences such as numbness, tingling, maybe inability to walk, maybe other muscle weaknesses. You can also see red eyes, nausea, and vomiting with ehrlichiosis as well. Mycoplasma is another one. Again, this is one that can shed its cell wall similar to Borrelia. It is responsible for what's known as Gulf War syndrome. It does have atypical presentation for pneumonia or walking pneumonia. You can also have hair loss, insomnia, you have GI problems, you can get joint pain, anxiety, headaches, cognitive problems, neurologic problems, and it mimics a lot of autoimmune diseases. The literature is looking at this, and they're seeing it in ALS, they're seeing it in rheumatoid arthritis, they're seeing it in IBS and Crohn's disease. So again, we see what these bacteria have the ability to do, so it makes sense as to why we're seeing these trends. Let's talk about chlamydia pneumoniae. Chlamydia pneumoniae can present as a cough, typically atypical pneumonia with walking pneumonia. You can get a headache, you can get malaise or just a general bad feeling, you can get bronchitis, you can have laryngitis, rhinitis, sinusitis, asthma. You can also have ear infections. You can get endocarditis. You can get the erythema nosodu. You can also get Guillain-Barré syndrome as well, which is a type of neurologic disease, and encephalitis. So again, you can see what this guy will do too, and this can come in a lot of times with Lyme's disease. So let's discuss the difference between acute Lyme's and chronic Lyme's. Acute Lyme's, you'll have more of those flu-like symptoms. You're going to get that fatigue, the joint pain, maybe even high fever can come in with it. Typically here, this is where antibiotics work well, and this is typically where most doctors will find, well, yeah, you have Lyme's disease, they'll treat 21 days with doxycycline and it gets rid of it. Part of the issue too is the infectious disease officials say that there is really no such thing as a chronic issue with Lyme's disease, that 21 days of doxycycline knocks out Lyme's disease. But we as practitioners find a lot of times that there are people that do that and still struggle with Lyme's-like symptoms. So part of that is whether or not these organisms are setting up shop. And if they're setting up shop and having those lipoproteins that are being emitted and all those other things creating that inflammatory cascade, then we start to see more of those chronic issues with it. And again, chronic Lyme's disease does not really respond well to antibiotic use. Some of you may be using that, and we're not downplaying it at all. But again, we know Lyme's will create biofilms. So unless something is being done with the biofilm and you're just doing antibiotics, a lot of times you have to have an integrative approach. And if you are using that, usually you can find a Lyme's literate MD that will kind of go through and do an integrative approach with the antibiotics. And we usually see this manifesting as other chronic conditions, and it can be a lifelong issue for people. So patients with chronic Lyme's disease may have some of the following. We usually see pain that comes and goes and migrates. So you can get arthritis, you'll have myalgia, neuropathic type pains. We see pain is influenced by a hormonal cycle, especially for women. So they say it's worse with the associated Herxheimer reaction either before, during, or after a menstrual cycle. And all they're getting is some maybe associated die-off. Antibiotic use may increase or even decrease the pain. So the person may actually be experiencing a Herxheimer reaction to maybe chronic sinusitis if they're getting treated for that, or urinary tract infection. Some people may mistaken this for, hey, I'm having a reaction to the antibiotic that I'm taking for my UTI because I feel horrible. Well, part of that could be the die-off that's occurring from the antibiotic. And pain might be resistant to standard treatment modalities like non-steroidal anti-inflammatory drugs such as ibuprofen, naproxen, your SSRIs like Paxil or Prozac or Cymbalta. Narcotics aren't touching it. Neuroleptic agents aren't touching this at all. And so we find this happens a lot in Lyme's cases. We also see pain that's associated with the multi-symptom or multisystemic symptoms. So we see a bunch of other symptoms throughout the rest of the body, kind of just, again, ebbing and flowing in their levels with problems. Let's talk about the MTHFR gene. Many chronic Lyme patients have the MTHFR gene, which is the methylene tetrahydrofolate reductase gene, and it's an abnormality in the ability to methylate. Methylation is the process of taking methyl groups to the cell and to be used at the level of the DNA. So defects with the MTHFR gene will cause high homocysteine levels, and the person is going to be more likely to turn on bad genes that they may be dealt genetically. So again, going back, your stomach is a primary methyl donor that we see. The methylation process is dependent on vitamin B6, it's dependent on folic acid and vitamin B12. It's also dependent on S-adenoacetyl methionine and trimethylglycine are also needed to help convert that process over. And typically this will drive your homocysteine levels up. Let's talk about glutathione. This is a very powerful antioxidant. Many Lyme's patients are in need of detoxification, so it works very well in the liver. Glutathione is an excellent way to help open up that detoxification pathway and help reduce inflammation, especially if you're doing treatment and you're getting a lot of die-off. And coffee enemas are a great way to increase your glutathione levels. You can also supplement along with N-acetylcysteine. You can do transdermal glutathione and acetylglutathione, which is an oral form. All of those work well to open up your glutathione pathways and help you detoxify. But coffee enemas are phenomenal. So let's discuss a couple of approaches. Let's discuss the medical approach. We'll discuss an alternative approach. We'll discuss my approach. We'll go over some specific testing, how I can help you, and some simple things you can do right now to improve your health. Let's look at the medical approach. A lot of times you go to your traditional MD that maybe not a Lyme's literate MD, and they blow off by Lyme's patients. They say Lyme's patients are whacked. MD thinks that Lyme's patients are crazy, that they keep coming in saying I have all these problems. They may send you off for psych evaluation and tell you it's all in your head, you don't have all these things happening, you don't have Lyme's disease. There's no such thing as chronic Lyme's disease. You just need to learn to live with it. It's not that bad. Just get out and do some exercising. You'll feel better. While exercising can help, again, you may be in so much pain that you're not able to do that. The alternative approach. Typically in the alternative approach may be like a Lyme's literate MD. They may tend to go and start on antibiotic use. And again, not downplaying antibiotic use, but again, if you want to look at what are we doing to address the biofilms, what are we doing about the multiple systems that are influenced with this? What about my thyroid, my adrenals, my pH? All those things, getting those components addressed is going to be helpful. My approach is integrated, and again, we work with people that may be on heavy amounts of IV antibiotics. We may be working with people that have done that and it doesn't respond. So again, we work with in both fields. We tend to take a neurologic approach and a metabolic approach to helping people get over Lyme's. So what's the best approach for the individual patient? So how do we know? We have to do lab testing, we have to do kinesiology to figure out what are we dealing with. Lyme's disease is a chronic illness. Your body's been sick for years and now most likely you've been mismanaged. Because a lot of times this thing can be there and it can lay dormant, it can just be wreaking havoc, creating all these other problems and no one's detecting it. Along with Lyme's disease, you could also have other health breakers that are there. You may have a web of physiologic dysfunction. So we're not only dealing with maybe your complaint is joint pain. Well, we may see some brain fog. We may see a pH problem. We may see thyroid issues. We may see GI problems. We see adrenal. We may see blood sugar. You can just see this whole web that is created from having an organism that's doing the things that we had talked about earlier. Again, you can have gut dysfunction. 80% of the immune system is around the gut. You could have blood sugar dysregulation. You could have inflammation. Your tumor necrosis factor, interleukin 1 and 6 could be high. You could be autoimmune. You could have brain and neurotransmitter dysfunction. You could have anemia. You could have lymphatic dysfunction or congestion. You could have a liver or gallbladder problem. You could have fatty acid metabolism dysfunction. You could have carbohydrate metabolism dysfunction. Energy production markers may be low. You may be reacting to electromagnetic fields or EMFs. You may have problems with your dental work. You may have toxicity issues or food sensitivities. All of these things have to be functioning optimally to allow you to have maximum healing. That's what it's all about. It's allowing the body to heal. The body will do that. Lab testing. Lab tests, part of the issue here is that lab tests are very broad. In our blood work, is usually the first place that we look at. We do a comprehensive evaluation. We do a comprehensive metabolic profile, checking your glucose, A1C, your liver, kidneys, iron levels. We'll look at your vitamin D, your C-reactive protein, your homocysteine, your fibrinogen, your uric acid, and many other ones. We also do a complete blood count with an auto differential in platelets. We also do a complete thyroid profile, looking at TSH, free T3, free T4, total T3, total T4, reverse T3, free thyroxine index, T3 uptake, and your antibodies as well. TPO and antithyroglobulin antibodies have to be performed. And we do a lipid panel, which is your traditional cholesterol, HDL, LDL, triglycerides. We usually do urinalysis as well to see exactly what is happening in the body. Second thing we can look at is sensitivity testing, looking at are you reacting to any type of food. Cyrex Labs has the ability to do multiple different types of tests. Array number 2 is looking at gut function. If we see actomycin antibodies, then we know there's degradation at the epithelial lining of the barrier system of the gut. So we are seeing some intestinal permeability. If we see antibodies to lipopolysaccharides, then we know there are gram-negative bacteria that are in the small intestine, and these are bad bacteria that have taken over from the good, what we call dysbiosis. And if we see gluten and zonulin antibodies coming back, then we know the tight junctions between the cells are failing. So we know we have a leaky gut or intestinal permeability. The third array that Cyrex can do is a gluten reactivity. So they'll look at glutenin, they'll look at gliadin, and wheat germ agglutinin as well. So it's about 12 different tests on the whole pathway of gluten. And they will look at a cross-reactive test. So you may be cross-reacting with other grains and other non-gluten grains. You can have reaction to corn, rice, potatoes, other grains such as buckwheat, amaranth, tapioca, teff, sorghum. You can see coffee, dairy, soy, and other things that come back reactive. And then array number 5 looks at autoimmunity. So we have the ability to see, are we seeing a trend in some tissues where the immune system may be attacking? Also, usually look at the ALCAT test. The ALCAT test, the person doesn't want to go down Cyrex path. This will run through a ton of different foods. They have the ability to go from 50 foods to 200, and what they do is they look at the white blood cell, its response to an antigen, in particular the antigen being food. And they grade that as to how big of a response the white blood cell has to that particular food. So it's a great way to know what foods to eat that's going to be more compatible with your physiology. They have the ability to look at chemicals, dyes, herbs, additives, and other medications to see what your reactivity is like as well. Third test we look at is an organic acid profile. We usually go through metametrics. It's a urine test. They'll look at your fatty acid metabolism, your carbohydrate metabolism. They'll look at your B complex markers. They'll also look at your methylation ability and methylation cofactor markers. They look at your neurotransmitter markers and your ability to detoxify. So this is a great test that we get a lot of information from. Fourth thing that we usually look at is a stool analysis, doing a microbial stool analysis. Have used metametrics in the past, maybe switching to biohealth. The vast majority of Lyme patients are autoimmune. We see this a lot in autoimmune cases, and we need to find out what's causing it. Again, is there an infection in the gut that can do this? It could be parasites, it could be yeast, fungus, bacteria, or viruses. So again, we have to test that to find out what's going on. Fifth thing that we look at is an adrenal stress index. We do this from a company called Labrix. It's a salivary test. It measures your cortisol levels. And this is to check your adrenal glands. Your adrenal glands are glands that sit on top of your kidneys and are responsible for stress. So your body has a chronic condition and your body's been under physical stress for a long period of time, so this is a very important test to run. The sixth thing we look at are hormones. We do it again through saliva, through Labrix, and they have the ability to test male and female hormones. The hormones usually are estrogen, progesterone, testosterone, and DHEA. Seventh thing that we look at are heavy metals. We do a heavy metal urine provocation from a company called Doctor's Data. Typically, these are assessed with a pre and post chelating agent. Heavy metals greatly interfere with the parathyroid and thyroid, but they also interfere with the immune system as well. They wreak havoc on the body because these organisms like to use heavy metals. Let's talk a little bit about functional ranges. Again, we talked about how lab ranges are so broad. We'll give you a couple examples of what functional ranges look like. So TSH, the lab core is 0.45 to 4.5. Functionally, we like to see that 1.8 to 3 is considered optimal. So again, you can see what happens in conventional testing. TPO and thyroglobulin antibodies, you typically like to see 0 to, or the lab sees 0 to 40. We like to see less than 10. So 0 to 10 is considered optimal. Glucose from the lab, 70 to 110. From a functional standpoint, we like to see 85 to 99. Also with ferritin, which is your stored iron, we like to see, or the lab looks at 10 to 291. So it's a huge reference range. From our optimization standpoint, we like to see 30 to 70 is considered optimal. And then looking at your liver enzymes, ALT and AST, lab says from 0 to 40. We like to see from 10 to 30 is considered optimal. In kinesiology, we hit multiple different points. We have sleep point that we test, we have an energy point, we have a thyroid point, a stomach point, an adrenal point, a liver point, a pancreas point, a brain point, a lymphatic point. There are multiple different points. These are acupuncture points that we test and see how does your body respond to those, if it needs anything to help it or not. And what we do in muscle testing is we look at the body kind of as almost like a polygraph. I give this example to patients a lot of times. In a polygraph, what they're doing is they're actually put you on a pulse ox, they measure your pulse, they put a respiration monitor around you to measure your respiration, and then they ask you questions that they know are true. State your name, your date of birth, who are your parents, where did you live, all those things that they have record of. Then they start asking the tough questions, and then they see, well, how does your body respond to those answers? And if the body responds and the pulse rate and respiration goes up, then they say, well, most likely this person's lying to us. It's the same with the body. The body will show us where there's an issue. If we hit different acupuncture points, the muscle goes weak, then that's suggesting to us that there needs to be some support there, or the body needs help there. And all we're dealing with here is innate intelligence. So we can just kind of describe to you, the body will show us where things are happening and where support and needs to occur. Let's talk about sugar. High dietary intake of simple sugars can lead to glycation of numerous protein cells in the numerous proteins in the cell. Glycation is the process of protein molecules binding to sugar molecules. And once combined with sugar, proteins are much more vulnerable to free radical damage. And this leads to what are called AGEs, which are advanced glycation end products, which interfere with dopamine and tyrosine utilization, causing increased inflammation, toxicity issues, and a decreased immune response. So again, you want to stay away from sugar. So patients with any type of chronic disease, including Lyme's disease, should not consume foods that contain fructose or high refined sugars. Advanced glycation end products signal glial cells to produce superoxide and nitric oxide. The combination can then produce the powerful free radical peroxynitrite that can worsen any chronic condition by damaging the cellular DNA and the mitochondrial DNA. So again, this is why you need to avoid it, because you're just going to compound the problem. So what if you have sugar cravings? A great fix for that is using raw, unfiltered, unheated Canadian honey with pollen. PRL, Premier Research Labs, carries this. You can also use Max B and D, which is a good live source of B vitamins on the liver, for the liver. And you can use the herb Gymnema. Gymnema can help with that as well. Let's talk about salt. Salt, which is sodium chloride, will lead to HCl. So it helps with lymphatic drainage and methylation. And you cannot maintain proper fluid balance in the large intestine without adequate amounts of salt. So even if you feel you have a good form of salt that you're using, many manufacturers grind their salts with stainless steel equipment and screens that leave nickel residues. So many of these also use anti-caking agents. So a good source that we use is what's called pink salt, which is sun-dried sea salt, and it's from the sources that Premier Research Labs use is from it's a Hawaiian and Mediterranean source, so they work very well. They sift theirs with wood, so you don't get any nickel residue, and they do not put any anti-caking agents in there, so you're getting a very good form of salt. We'll talk a little bit more about salt later, but you have to have enough salt for the adrenals. Let's talk about water. How much water should you be consuming? I usually say about half of your body weight in ounces per day. Your kidneys will filter 2,000 liters of blood per day if you're 150 pounds. So less than this just means you're dehydrated, which corresponds that the kidneys and adrenals are not able to function properly. So you need to be consuming good forms of water. Do not drink tap water. You want to do reverse osmosis water, filtered water, or maybe something like distilled water and add minerals in. But the distilled water is going to be very, very good. Let's talk about fluoride. Fluoride, bromine, and chlorine compete with the iodine molecule in the thyroid. So a lot of you have thyroid issues, and Lyme's is a big one for this too, but these things will really wreak havoc on the body. Iodine is needed for the production of thyroid hormone. T3, T4, all that designates or all that tells you is how many iodines are attached to it. T3 has 3, T4 has 4. So how do you get fluoride, chlorine, and bromine anyway? You get it from tap water, you can get it from toothpaste, pesticides, hair colorings and dyes, flame retardants. All these things are ways that we come into contact with fluorine, chlorine, and bromine. You can get cancer, you can have brain damage, you can get low estrogen and testosterone levels, you can have stomach damage, joint pain, you can have osteoarthritis, osteoporosis, memory loss, you can get lack of motivation. It will inhibit melatonin. It will cause kidney stones. It will cause immune impairment. You can get infertility. It will attack your thyroid. It will attack the hypothalamus. It will adversely affect circulation. It damages the DNA and is toxic to your brain cells. So this is another reason why you are going to want to avoid those compounds, fluorine, chlorine, and bromine. Let's talk about magnesium. It's utilized or necessary for proper bone formation. It maintains a normal muscle function, and it also releases energy from muscle storage, and it regulates body temperature and also allows for proper absorption of calcium. Magnesium is held in the blood by adrenaline. So your adrenal glands are the ones that are responsible for making adrenaline. Adrenals need water, they need salt, good forms of salt like pink salt. They need B vitamins, natural life source B vitamins like Max B and D. It needs vitamin C, not ascorbic acid, but true vitamin C. And you're going to need 5 or more hours of continuous sleep to make adrenaline. They did a military study and found that if you do not get 5 consecutive hours of sleep, you're not going to make enough adrenaline for the day. So this is another reason why we have to get you sleeping if you cannot sleep. If your adrenals are not working, you will not have sufficient magnesium, and yet another reason why you're not healthy. Low magnesium at the neuron or the nerve cell can lead to the production of protein kinase C2, which in turn can increase inflammatory arachidonic acid. So it'll drive that inflammatory cascade. So again, you don't want that happening, especially if your tumor necrosis factor and interleukin 1 and 6 are high and you have sickness syndrome. It's just going to make things worse. Chronic depression, usually a problem with the adrenal glands. And the problem is no one's addressing the adrenals. So this is another reason why we have to go over this and address that. Let's talk about bad oils. The widespread use of hydrogenated oil, trans fats, in our food, which is known to reduce cell membrane fluidity, and it makes the cell more permeable to viruses, bacteria, and even more susceptible to cancer. I always tell people it's kind of like a balloon. If you have a balloon and you go and push into the balloon, your fingers should bounce into it and push out. And that's how the cells should be. It should be nice and fluid. If you're eating a lot of bad oils and trans fats, the cell will become rigid. So when a virus goes to land on the cell, it lands pretty easily and can inject its DNA into the cell. Same with bacteria or other organisms can get on that much easier rather than bouncing off. Canola oil, this is very rampant today. Even in some health food places that you can buy food will have a lot of canola oil. It's nothing more than rapeseed oil. And this stuff stinks. They have to deodorize this stuff. But it does make a good furniture polish. So again, you're going to want to eat and consume good oils. Let's talk about homocysteine. Homocysteine can be generated in response to a toxic or nutrient deficient diet. When homocysteine is increased in the blood, it is linked to neurodegeneration, meaning your brain and nerves are starting to degenerate. So in Alzheimer's disease, we find a significant increase in homocysteine. Since homocysteine is a powerful excitotoxin, elevated homocysteine levels have been found in Alzheimer's patients, and it makes Alzheimer's disease worse. The metabolic breakdown components of homocysteine alter the NMDA, which is the N-methyl diaspartate receptor sites, leading to multiple negative effects, which include free radicals and an inflammatory cascade. So this, again, another reason, especially if the person has the MTHFR gene and they do or don't know they have it. If they know they have it, you're going to want to make sure you get your homocysteine levels down. If you know you don't have it, you may want to be tested for the MTHFR gene to see what am I going to have to do to ensure that my homocysteine levels are staying lower. You can have too low homocysteine levels, so if your homocysteines are really low, then this is usually associated with impaired detoxification or not making enough glutathione. Remember, HCl, it's vital for your methyl groups. And methyl groups are important for homocysteine metabolism and for phase 2 of liver detoxification. Let's talk about interference fields. An interference field is created from a trauma, a surgery, or a blow to the body. Tattoos, piercings will create an interference field. And what this is where energy does not flow through that site, and a lot of times they reflect to other areas. So let's look at some common interference fields. The thyroid is one. We tend to see the thyroid can be trauma to the chin, the neck, the nose, the forehead. The stomach, we tend to see clavicle trauma, chest. You can see chin, nose, forehead. You could have a hysterectomy or episiotomy could create that. For the thymus gland, could be again chin, nose, forehead. Could be clavicle, chest, or neck trauma. We can see with the liver, you could have an appendectomy. We see that one a lot of times with an appendectomy to the heart meridian. You can have a hernia, you can have a chest blow, you can have hysterectomy, episiotomy there to the liver also. So what we use are PRL's mud packs, which is called MediBody Pack. This is a premier quality formula that can be used as an effective, elegant cleansing body pack. It contains premium clay, peat magma, and targeted botanical agents with all key cleansing agents that have been used for centuries in many cultures, so this works very well. The MediBody Pack initiates a deep thermal effect, which is deep and intrinsic, has a deep intrinsic cleansing effect, and it's very unique because it's a clay botanical formula made of 100% quantum quality ingredients with no oxidized peat or weak or dead clays. The mud pack can even be applied to the area of a tick bite. So if you've had a tick bite and you've got a rash from that, or it's still even giving you some problems over where the tick bit you, you can put the mud pack on there. It works very well. Let's talk about emotions. The CDC recognizes that 85% of diseases have an emotional component to them. So again, this is another thing that we have to address. A lot of times we run through several of these statements here. I can be healthy. I can now be healthy. This is a big one that we find a lot of people consciously want to be that way, but subconsciously they don't. So we've got to get the conscious mind in line with the subconscious mind. I can do whatever it takes to be healthy, and a lot of people have been here as well. They go and start a program, then they end, and they fail at it. And part of the issue that we want to see is success. And we have to go through and clear that subconscious to allow the body and the brain and mind to do whatever it takes to be healthy. The big one that we see a lot of times is I can now love myself, I can now forgive myself, I can now love and forgive. In Chinese medicine, emotions are associated to specific organs. For example, the liver could be anger, resentment, jealousy. Kidneys could be fear and anxiety. Also in Chinese medicine, we see specific pain syndromes are related to specific organs as well. A liver can usually be neck and shoulder pain. Kidney, usually low back and leg pain. Big one for Lyme's is insomnia, so we'll talk about that. If you have the inability to fall asleep, this is usually going to be a problem with your gallbladder. Inability to stay asleep is going to be the stomach. If you're groggy in the morning when you wake up, it's the adrenals. So again, we've got to get you sleeping better if you're having issues here, and we'll test you for that. Gallbladder, this is another one that gets hammered a lot of times too. We've seen many people with Lyme's have their gallbladder removed. Over 40 usually is where people start to have problems with it. A little bit more females than males, but we both have issues with it. B6 helps to keep bile salts in suspension in the gallbladder, but birth control depletes the body of B6. So if you've been on long-term birth control use, this is going to be a potential disaster waiting to happen. High stress will also deplete the body of B6. So again, if there's physiologic stress from an infection, you can see what this is going to do in the gallbladder. And again, B6 keeps bile salts in suspension. So now when you eat fats, you don't absorb them because you don't have the bile salts necessary. So then you're unable to absorb vitamin D. Yet another reason why a lot of people will take vitamin D and they're not getting their vitamin D levels up could be the problem with the gallbladder. Bile also removes waste from the liver and relieving excess cholesterol within the blood. What about if you don't have a gallbladder? Well, most of the time we find some people that have no gallbladder at all will still have issues in their gallbladder. And part of that, again, is the liver's helping to manufacture bile, but you still need to make sure you're getting adequate support, even if the gallbladder is not there. Let's look at the liver. Again, the liver is responsible for bile production and excretion, the excretion of bilirubin, cholesterol, hormones, and drugs. It's the metabolism of fat, proteins, carbohydrates. There's enzymatic activation that occurs in the liver. You get storage of glycogen, vitamins, and minerals, the synthesis of plasma proteins such as albumin and clotting factors. Blood detoxification and purification happens in the liver as well. So if you have a problem with your iron levels, your total iron binding capacity, your ferritin, your cholesterol, or your B12, you have a liver problem. So coffee enemas work very well here. Max B and D works very well here. The liver has over 500 functions in the body, so it's very important that we get this one back up. Let's talk about brain fog. As you age, your ability to utilize oxygen decreases. So after the age of 25, we see a decrease by 1% per year. So by the time you hit the age of 50, you've lost 25% of your ability to utilize oxygen. That's one of the reasons why we utilize this in office and helps a lot with it. And if you have another issue like babesia, which is responsible for air hunger, it's going to be even more problematic for you. Let's talk about EMFs, which are electromagnetic fields. Electricity is the movement of current or electrons. This type of electricity running through the power lines is an alternating current. AC power produces two types of energy. There's an electrical field and a magnetic field. An electrical field is produced when the voltage, which is the force needed to push the electrons through the wire, much like water being pushed through a hose. A magnetic field from the flow of current through the wires or electrical devices. It increases as the strength of the current increases. The two fields together are referred to as electromagnetic or EMFs. Since magnetic fields are most likely to penetrate the body, they are the component of EMFs that are usually studied in relationship to cancer. So examples of devices that emit EMFs are power lines. You can have electrical appliances, scanners in stores, electrical shavers. You can have televisions, microwaves, Wi-Fi. All those things will do that. Cell phones. And most appliances have to be turned on to produce a magnetic field. And the strength of the magnetic field decreases the further away from the source you are. The thyroid is the shield from EMF radiation. So again, we want to make sure that we get your body supported and protected from electromagnetic field. It's because of what it does to the thyroid. When there was a meltdown at the nuclear power plant in Japan in Fukushima, there is or was or still is a lot of concern about thyroid cancer. So again, another issue that we want to look at, supporting the body so that we protect the thyroid. Xenoestrogens. Xenoestrogens are chemicals that mimic estrogen and compromise hormonal function. Studies show xenoestrogens cause cancer. They wreak havoc on our bodies. Xenoestrogens are caused by hormones in meats and pesticides in fruits and vegetables. In dairy, we see milk, cheeses, butter, ice cream. Usually the bovine growth hormone and strontium 90, which is a radioactive isotope from radioactive waste, can be in those products. So again, you want to make sure if you're consuming dairy, ideally raw's the best, but if you are consuming that, at least hormone-free. The dirty dozen. These are usually going to be the ones treated with a lot of pesticides. Your grapes, which are wine and raisins, apples, celery, bell peppers, peaches, strawberries, nectarines. We see spinach, lettuce, cucumber, blueberries, potatoes, green beans, and kale. So where else do we see a lot of these xenoestrogens? Synthetic nutritional supplements are a big one. We see xenoestrogens. We'll see them in laundry detergent, fabric softeners. We'll see them in coffee. We'll see it in birth control, microwaving plastic containers, hormone replacement therapy, soy products, soaps and shampoos. So these are all things you need to think about. To get your body to heal, you may have to go through your house and remove some of these things and phase in things that are healthier for you. You're going to want to avoid anything that's been enriched. Organophosphates or pesticides deplete the liver's ability to detoxify. CoQ10 is oxidized, the vast majority of it out there. Vitamin D is solvent extracted from sheep's wool. And we know B vitamins are derived from coal tar as well. And ascorbic acid is not vitamin C. Avoid animal glandulars because, again, they've been exposed to things like hormones, antibiotics, hormones in the feed, pesticides, genetically modified feed. And this is why I mainly use Premier Research Labs products, or PRL's products. We use a couple other ones, but we use quality nutritional products. And I use an individually tailored natural protocol to allow your body to achieve maximum healing. It has to be individually tailored because no two Lyme's patients are alike. Each person is different in their presentation. This is how we're going to help you heal. Our goal is to decrease inflammation, detoxify your body, and increase the function of your immune system. It has to happen. So how do we do it? First thing we do is we optimize your pH. 6.4 to 7 is optimal. You're going to start juicing. We're going to do organic vegetables. We're going to do coffee enemas to detoxify the liver, but only after we test to see what does your body need and what path we're going to go down. Vitamin D is what we're going to use. We're going to use aloe. We're going to use minerals. The other important component to this is detoxifying the body. This is very important. We got to use detoxing foot bath that we do. We use mud packs. We use those on interference fields. We got to balance EMFs and get your body supported there. We can use dietary cleanses. We can use nutritional support. Work on the dental issues. We've got to protect you against cell phones. Third thing that we use in the office is exercise with oxygen therapy. This is phenomenal on the brain. The nervous system loves this. You hyperoxygenate the tissues and you'll drive cerebellum and frontal lobe with this therapy. You have to do neurologic testing and support. Your brain is getting hammered by all these inflammatory cytokines from this issue with Lyme's. We've got to detox the body. We also have to build the nervous system up and get the nervous system firing. There's a neurologic component to Lyme, so we've got to get the brain firing better, so the numbness, the tingling, the brain fog, the dizziness, all those things can improve. I would love to be your patient, Dr. C, but I don't have the money right now. I'm on disability because my Lyme's problems and issues are so bad that I'm unable to work. It's okay. You can still take quality nutritional supplements, and we can help you with that. I use only the highest quality of supplements because I take them, and myself and my family does as well. We see results with them. Your health is the best investment you will ever make. One of the things that we recommend that people do, and this are some of the things we use for treatment: pH balancing. We use D3, PRL serum D3. We use Aloe Pro from PRL. We use Coral Legend. We're looking at a couple other minerals that we can add in. For cell energy point, to get energy back up and running, we use Quinol ND. Neuro ND has been on back order for a while. We're hoping this will come off soon. Coenzyme Q10, IP6, and Alomannan. These things work very well to get your energy levels up. To support the stomach, we're going to use Gastrovin. We're going to use hydrochloric acid, an HCl activator. We're going to use Digest as well. For the intestinal support, we're going to look at Probiomax Daily formula. We're going to look at Saccharomyces. We can also do Probiomax Daily DF+. We can use Digestase from PRL, OptiCleanse GHI, and also Glute-Alamin as well to get the gut to heal. For the liver, we can use Max BND, we can use Liver ND, Medcaps DPO, and Max Live Detox. For the gallbladder, we can use Gallbladder ND or Bilavin. For the sleep, or for getting you to sleep, Tranquinol, Melatonin, NADH. Again, supporting the adrenals or the gallbladder as well. For inflammation, we use alicidin, turmeric, CoQ-curcumin, A-inflam, and green tea ND. Again, green tea ND is going to decrease interleukin-6. It's going to be phenomenal on that. For detox, we're going to use N-acetylcysteine. We're going to use S-acetylglutathione, DIM, which is diindolylmethane. Methane. We're going to use glycine, Mediclay. We're going to use coffee enemas, Gamma Detox, and Keylex to pull out metals and other things in your body. For immune support, we use the Byron White formulas. These things are phenomenal on supporting your immune system. We can use cat's claw, olive leaf, paratocin, Parastat for parasites, probiotics, IgG. We can use antioxidants as well. These are going to be very important. Things like resveratrol, alpha-lipoic acid. We can also use glucoramine. Back it up. Back it up. For immune support, we use the Byron White formulas. These are phenomenal on supporting Lyme's patients and doing it naturally. Cat's claw, olive leaf, paratocin, Parastat, probiotics, IgG, all these things work very well. For antioxidants, we can use resveratrol, alpha-lipoic acid. We can use what's called Oncoplex, which is broccoli seed extract. We can use Neuro ND, which is DHLA. And we can also use Quinol ND, which is a very good form of CoQ10, and Deltanol, which is delta-tocotrienol. We want to keep in mind interference fields, electromagnetic fields, and dental infections and dental issues. Going back to Neuro ND, this one's been on back order. Again, we're hoping it's coming off very soon, but it's DHLA, which is the most active component of alpha-lipoic acid. And this thing's phenomenal because it's ATP boosting. It quenches every free radical in living tissue. It regenerates your CoQ10, your glutathione, your NADH, your vitamin E, and your vitamin C. A lot of times we use what's called a rocket fuel cocktail to really get your energy levels up and running. This has Quinol ND, has Neuro ND, Green Tea ND, and Max BND, and it'll shoot your energy levels through the roof. So I want to give you hope. I want to give you empowerment. I want to give you control, and I want to give you some options. I want to help you survive, not just survive, but to thrive. I want you to thrive 365. Consultation for me is normally $250, and on a scale from 0 to 10, We want to see 8 to 10 on the severity of how strong they want to get better. If you're an 8 or 9 and 10, then this is for you. If not, it's okay. When you're ready, we're here. So we only want 8 to 10 on the commitment of how you're wanting to get better. If you mention this DVD, you'll get an evaluation and 2 free visits for $60. So again, we discount this for you so you can come in and see if we can help you. A couple things we have to let you know up front: insurance is not going to cover this. But what's the value to you, and does this make sense? We're here to help get people better that don't have anywhere else to go. People come to us as a last hope, and when you're ready for this type of care and are committed, then we're here for you. We will do everything within our power to work within your finances. Information without action is not going to help you. So set an appointment for a consultation. It's like the definition of insanity. I think Einstein said it's doing the same thing over and over again expecting different outcomes. And again, don't do the definition of insanity. Go outside of that, do something different, call us and set up an appointment for a consultation. It doesn't mean that you have no chance of living a full, long, happy life full of energy. We can get you there. So what can you do right now? First thing you can do is change your diet. So no more refined sugar, no high fructose corn syrup, including sodas, no red meats, caffeine, alcohol, white flour, white salt, fruit juices, highly saturated fats, trans fats, and all food additives, colors, coloring agents, and preservatives. No more junk food. If you smoke, now's the time to stop. The second thing you can do is increase your amount of fresh organic vegetables in your diet. No or very limited fruits, and if you eat fruits, maybe a little bit more on the stone fruit side, which are fruits that have pits in them, like peaches, cherries, plums. Do organic grass-fed chicken and wild fish, and you're going to want to limit, again, if any, red meat, because it is a little more pro-inflammatory. For detoxification, you can do massage. You can get in a sauna, steam room. You can drink distilled water. These things are going to help you detoxify. Get out and get sunshine. Vitamin D is how we get vitamin D from the sun. And a lot of doctors tell you that don't get out in the sun because of skin cancer. An SPF as little as an 8 will block 98% of synthesis on the surface of the skin when it comes to vitamin D. I'm not saying for you to get out there and burn, but get out and get moderate sun exposure. And if you do that, you're going to increase your vitamin D levels. It's the best way to get it to the sun. You're going to want to take good quality nutritional supplements. We can help you with that. You're going to want to use good fats: coconut oil, olive oil, eating avocados. Stop eating gluten, dairy, and soy. These are the big 3 inflammatory producers. Remove those out of your diet, and you should start to see some improvement. Exercise. Do the best you can. If you're in a lot of pain, start somewhere and do with what you can do comfortably, but exercising can be very helpful for your brain as well. You're going to want to avoid heterocyclic amines. These are charred meat. So anytime you see a black part of chicken, you're going to want to cut that part off. This is cancer-producing compounds. And you're going to want to read labels. You're going to want to avoid anything that says natural flavoring. It's code word for MSG. I'll leave you with some final thoughts. I love this one that says, when there is no vision, the people perish. And that is so important for us to have vision as to where you see yourself going in the next couple of weeks, months, years. So picture yourself getting better and doing the things that you love to do, whether it's traveling, participating in a sport, going back to school, whatever is in your mind that you want to accomplish. See yourself spending more time with your family, your friends, and loved ones. Ask yourself the following questions. How has Lyme's disease affected your relationships, your finances, your family, or other activities? Or if you don't know you have Lyme's disease, your chronic condition. What has it cost you in time, money, sleep, and happiness? Where do you picture yourself in the next 1 to 5 years if this problem is not taken care of soon? And what is it worth to you if we can improve your condition? Your body will heal, but it needs the right tools and equipment to do so. And you are the treasure. It's not your house, it's not your boat, it's not your investments. Your health is the one thing that you have. You can lose everything, but if you lose your health and still have your health, you have a lot. But if you lose your health, you've lost so much more than that. So your health, again, is the best investment you will ever make. The other thing that I ask is you share this DVD with others. You can get on Facebook. on internet message boards. Share it with your family, your friends, anyone else that may be suffering can definitely benefit from this information. Help me spread the word. I cannot do it without you. There's so many people that are struggling. And if you're interested in setting up an evaluation, call our office at 919-662-0520. We'll be happy to get you in and discuss your problems and see if we can help you. And if you would like to email me with any question, it's ac@seaychiropractic.com. I love this quote, and I'll end here. It says, "Don't judge each day by the harvest you reap, but by the seeds you plant," by Robert Louis Stevenson. And this is a seed that you're planting. And what you're doing, you're starting here. And you're going to nurture that seed and see the harvest that's going to come about from it. So if you plant good seeds, you're going to get good harvest. If you plant bad seeds, you're going to get bad harvest. So definitely plant the right seeds, and take action with the knowledge that you have. Thank you for watching.